Hello, everyone. Welcome to the Easy Peasy Mealtime Show, where parents and therapists talk about tips on feeding your kids. And today we have three special guests. We have Sarah from Bringing Up Betty, an amazing podcast. So make sure that you click on that and follow her on her podcast. And she is a mom, and she's going to give us some tips today. And we have Lauren, who's our friend from Easy Peasy, yay, who I actually got to meet in person at the Anchor Center for Children for the Blind here in Colorado. And she's going to give us some tips today, too. And then we have Sarah. Thank you so much for joining us. We have two Sarahs today, guys, to give us some tips as well. So we are just so grateful to have all of you guys here today. And I just want to tell our viewers to, make sure that you tell a little bird for somebody that might be wanting to watch this. Maybe they have a child with low vision and they're struggling with feeding them, or to make sure that you post this on Facebook as well. So thank you so much for being here. Hi, TechSoup. Thanks for joining us. Hey, Kevin. Thanks for joining us. So let's talk shop about feeding. And I know, Lauren, you have some limited time here, so maybe we should start with you a little bit too.
I could be okay. We might be okay. My husband came home early, so Owen's entertained. So
great.
We're okay.
Thank you, husbands. Okay, so while we get some questions here on the side, I'm going to start off with a couple of things. I had the privilege to be able to poll 52 speech pathologists and occupational therapists about what we were going to talk about on the Blab, and ask them some of their feeding methods and what they do to help their kids with low vision. And I would love to just talk a little bit about that and get your guys' feedback and see what your thoughts are. I'm hearing a little ticking. Are you guys hearing that too?
I am.
If anyone can,
I hear it.
Can
it's probably
decrease that, that would be fantastic. It sounds like.
I hear it also. I don't.
So you can look at that.
Computer, like a disk or something.
so like the. Is that better?
The what?
Is it better? No.
No, not yet. Not yet. Okay. Well, if someone can handle that, that would be great. So one of the methods that the therapist said, I asked them what feeding methods they use to be able to help a child who has low vision. And one of the methods that they talked about was the clock method. And so what that is basically, spreading out the plate in a clock, 12, 1, 2, 3, 4, 5, 6. So saying, Johnny, your, green beans are at 6 o'clock and your, mashed potatoes are at 2 o'clock, etc. The problem with that is that only works for kids who actually really have the concepts of time and can be able to understand that, but doesn't really work as well with our little ones. Do you guys use that with your kids, or tell me a little bit about what strategies you use? Who wants to go first? How about Sarah from Bringing Up Betty?
We don't use that method. Understanding a clock is probably like 10 years away from us. So, yeah, that we don't do that. We kind of like put the food out and she eats.
So
can you hear me okay?
Yes, I can hear you great. Can you guys hear all right?
Yep.
Yeah,
for a
right
second,
now
that little scratch. Okay, how about you, Lauren? What do you use? Do you use that clock?
We don't use the clock either. No, it's kind of a free for all. But we do separate all of like his food, like the meats in one area, whether it be a section plate or not. So we try to divide kind of the foods up, but not really. He has some vision though, so he could see what's on his plate and stuff. So, but it's really a free for all for the most part.
Okay. Yeah. How about you, Sarah?
We haven't used the clock method yet. I have one of those little, I think it's Melissa and Doug clocks. And so eventually she's going to learn that, but I have to burble the numbers and everything first. So we haven't used the clock method yet. We will, because that's, I think, a good orientation and mobility thing that they teach as well with the clock. Just like military, they do that as well, It's just helping them to learn to get around. So I think if we start using that, we might start soon, but we're not too far yet. We just separate in different bowls. And I say, in the ceramic bowl, there's something different. And then I'll use an adjective. So she's feeling the different bowls, plastic, stainless steel, ceramic, glass, whatever.
Got it.
But she's not a thrower. So the easy peasy wouldn't We haven't tried it yet, but now that there's a smaller mat, we will.
Oh, yay! Great,
Yay.
Yeah. My shameless plug of always using the mat. How I use it with my clients is I just use the face as a way to do that, and it works really well with our little ones because they usually understand the eyes and the mouth, and so being able to say, on your right eye is this, and on your left eye is this, and on your mouth is this, and that's been really easy to be able to kind of manipulate that on using the happy mat. Even using the micro mat, our little tiny one, so you can see the difference in size, using that for taste. So if I'm using some new taste for my kids with low vision too, I just kind of suck that onto the edge of the happy mat and just utilize that too, saying, on your little, mat, these are the tastes in there. So a little bit of ketchup or ranch dressing or something new in there as well. So let's see if we have any questions. Nothing right now. Okay, great. How about the types of finger foods? Let's talk about that because a lot of parents ask me, what finger foods should I use? How should I use them? It gets so messy at mealtime because they're just trying to feel for everything and, and it just becomes this huge mess. Tell us about some finger foods that you guys prefer or things that you like. How about Sarah from Bringing Up Betty first?
Betty loves food, and so she considers anything a finger food. Like, it can be spaghetti or like soup. I mean, like that's kind of a challenge for us right now is like we're trying to transition to utensils and she just wants the food. So if you present a spoon to her for her to grab, she'll grab the food off of the spoon.
Okay.
Mealtime is really messy for us. And initially she did have some like tactile defensiveness. So she would not touch anything on her tray or her mat. But she's obviously moved past that. And now she's like Cookie Monster. I mean, it's like everywhere all the time.
Yay!
So.
Yay! I love it.
It's good that she's eating a lot, but
yes.
Yeah.
So great. How about you, Lauren?
Owen also is pretty finger food, pretty much everything. He likes to pick everything up. But we did a lot of frozen food when he was littler. That's how we kind of started. He loved frozen food. We just defrost, freeze bananas, freeze slices of apple, freeze whatever. And I don't know, I guess he liked the texture or whatever of it, but he would always just pick it up and eat it. So we did a lot of that. A lot of his food is finger food, though, Great. For sure. So we kind of cut everything up and put it on the plate, and he takes everything. So
wonderful.
Yeah.
We use finger foods too because they can feel the coldness a little bit easier. So when they're reaching in to, really have that temperature difference, be able to feel the cold foods or not. And also it's great for obviously teething and, sore gums or cavities.
Yeah. When he was a baby, he loved it.
Oh, so great. So great. How about you, Sarah? What finger foods do you use? And
for us, our little girl she's happy with pretty much anything, but she has her certain favorites, like certain things she will love eating, no matter, even though she has an aversion to like gooey things. Oh. So mashed potatoes, hummus, stuff like that, she loves the savory things. So she doesn't mind, but other things, she'll put her hand in it. If it's a new taste that she doesn't know, she'll say gross, and then she'll be done. So we've been working through these, but she does great with berries and, those little things that are easy to pick up. Anything roasted, she's happy with. So
perfect. Oh, perfect. Well, and I love the fact that they are all such great eaters. That's really fun and it's surprising for me to really hear that. So do they all eat rainbows? We're talking about berries and roasted vegetables and hummus. I mean, these are really good, healthy foods. Is it all of you experience that they're all really getting like their rainbows and having a lot of good nutrition?
Yeah,
Sarah, let's go in order. Sarah, answer first.
Betty loves just about everything. I'd say her least favorite food group is vegetables. But if they're like presented in the right way, she likes them. Like she doesn't love cooked peas, but she'll eat them frozen. So it's just a matter of figuring out trying mashing something or serving it frozen or serving it like cut a different way or something.
Okay.
but yeah, she gets just about everything.
That makes me so happy. How about you, Lauren?
Owen loves peas, favorite. He'll eat pretty much anything also, but he doesn't like it, I discovered, when you mash it together. You know what I mean? Like if you put it together, he likes all of his food separate. Like, you know, he'll eat the different things together, but if you put the peas with the chicken, it kind of throws him off, and I notice he doesn't eat it as much. But he does like peas with macaroni and cheese. That you can mix together, and anytime he has macaroni and cheese, he needs the peas now. Because I did it once. So
he's struggling with...
He likes it. Yeah, he doesn't like things together. I think he likes to know where everything is and how it all is.
Yeah.
But he'll eat anything. He's a phenomenal eater.
So exciting. And how about you, Sarah? I mean, you're saying the berries and the hummus. Wow.
Well, yeah. So for us, the issue has been like bean skins. She's fine eating beans. She's fine with refried beans. But when it comes to the skins, she'll leave it in her mouth and just mull it over for a couple hours. And later I'm like, oh, why haven't you been talking? And she's got this bean skin that she's still working on. So she'll gag on those little things like strawberries. I bought 3 cases of strawberries because they were on Supercell, and I was like, sweet, we're going to go through so many berries and it's going to be great. And she wouldn't touch them. And last summer she was fine eating them out of the garden. So I'm like, okay, well, wow. Yeah. So just some things that have, we're just hitting some new things that we didn't have issues with before. But yeah, so textures for us, we're still working through getting past purees.
Gotcha.
But and skins of things. So rice, we're just barely getting to, which is kind of behind the curve from some others. But like things like corn on the cob that she can eat by herself is great.
Oh, and that's a whole bunch of textures too. So we have the liquid of the corn. We have the corn husk, the parts of the skin, and then as well as the meat in there. So that's like 3 textures there. I mean, when we're talking about, texture and texture aversion, it's interesting because we don't think about, all the different textures. If we're eating a berry, that skin is one texture, the liquid's another texture, and the pulp is another texture. So that's a 3 texture type of food that we get excited about as feeding therapists. We want them to be able to experience those things. So being able to, what's called food chaining it from, she's not eating the bean with the skin, but eating the blueberry with the skin, and then explaining that the 3 pieces and being able to describe those textures throughout. That's, fantastic way to be able to chain her to be able to handle more and more purees and have a little bit more chunk of it, a little bit more pulp, and then a little bit more using all 3 textures. So fantastic. The strawberries, you know what? I always have kids have difficulties with them. They like the taste of it, but they don't really like the outside part of the strawberry. Yeah. So I usually will cut, all of the bumpiness off of the strawberry. And the other thing too is that, if you think about how we eat strawberries, how sometimes the little tiny seeds get into your teeth. Well, if you don't have the oral motor skills to be able to do this, and to really have that suction in there, strawberries is a really difficult texture for you to be able to handle as a kid. So, and if you're not able to see it, to be able to see that little tiny piece and kind of get that out, that can make it a little more challenging. So I tend to slice all the skin off and be able to, eat the core of that strawberry and then add a little bit more to make it a little bit more challenging each time. Or being able to use something else and pureeing the strawberry texture and being able to, kind of dip that in is another strategy that we use in feeding therapy. But I love hearing, the different struggles. Anyone able to figure out what that noise is yet? Okay. So one of the things that the speech pathologists and occupational therapists were talking about is their struggles if they're going to do in-home therapy with the parent. The child is doing great with self-feeding, doing great with being able to eat more independently. The problem is school. So I know Betty just started going to school, so maybe we could talk a little bit about that. And they have the lunch trays that are a little bit bigger, or the divided trays are, they're not as good as with contrast. And kids really struggle when they go to school with eating because they don't have that visual support system. They don't have that, therapist or parent or teacher that's there and walking them through that. Does anyone want to talk about that? If you guys are in schools and school age, I'd love to hear some techniques.
I had a little bit of a disappointing experience Sorry, my cat just walked by. In the first week, I took Betty's Easy Peasy Happy Mat to school to show the OT, this is what we use at home, and she does really well with it. And he was like, yeah, that's great, but, kids need to learn, not to throw trays. So, yeah.
We'll get there.
Anyway, I guess that they're working on that with her. So, yeah, but as far as I know, she's eating pretty well at school and stealing off of other kids' trays too. She loves food, so if it's within, and she has the go-go gadget arms, because we want her to cruising to get toys and stuff, but she just, can reach super far, and I'm sure if there's something tempting on someone else's tray, she's gonna get it.
I love it. How about Owen? How's he doing at the Anchor Center with
He does great. He does great. Yeah. I mean, we don't have any problems, but I'm there with him, so it's a different situation. Right. He hasn't really been away, but even if my relatives have taken him to a restaurant or anything, they say he has no problem. So he's just really picky. He doesn't eat. If we're out, he doesn't eat that much. I don't know if it's distraction or a change of whatever it may be. But if we go to a restaurant, he'll eat just a little bit. He likes the French fries, and it's kind of lunch or dinner for him if we go out. But at school he does fine. But like I said, I'm there with him, and they focus specifically for the visually impaired. So it's very conscious of what they're doing, and it's very routine. He does it every week there with the same teachers in the same way. So he's pretty regimented like that. So
that's wonderful. Yeah. And Sarah, how about your daughter?
She's only 20 months, so we haven't had to worry about that yet. But so hopefully we'll cross some of the milestones we're hoping to get to before we're having someone else watch her, often. Yeah, but usually I just prepare foods for her that she's familiar with, so it's not an issue. So
excellent. So Carrie seems to be doing okay. How about let's talk a little bit about manners, and the reason why is because when you bring that up, Sarah, it's so interesting how many therapists in the schools want to focus on manners with our kids who haven't even met a milestone in feeding, or they want them to, utilize the utensils. And, if our kids are a little bit delayed, we can't have that expectation of, perfect manners of not throwing trays or being able to use a fork efficiently or any of those things. Or another teacher when I was at an IEP, he said, we just need to teach her manners and she needs to say thank you. I'm like, she's primarily nonverbal, so let's work on these speaking skills first at school and making it appropriate, and then we'll get to thank you. It's irrational sometimes to be able to really focus on those things. And I'm always saying, we'll get to those manners, from using utensils and doing all those things once we're able to, get past a certain milestones. And the teacher saying, well, she doesn't stir correctly. She doesn't spoon correctly. She doesn't spread the food correctly. Again, I'm just thrilled that she's eating a peanut butter and jelly sandwich at school in an environment. We can work on those spreading skills and different things later. So any comments on that from you guys?
I know for me, I started at a really early age, just once we started food, Owen always had a spoon with him. He didn't use it, he didn't whatever, but it was kind of our cue. So he's always had utensils with him, so he's really good with them. And then, he has an older brother that he follows and imitates all the time. So he's picked on things that we tried with the older brother, like he has to say, "Am I excused from the table?" or bring his plate to the counter. But he has a really good role model for that. So we kind of started early with a lot of those manners, but it's not really our main focus more than, it's kind of happening naturally. So we don't really have that problem at this point, but I think it's because of his modeling that he's around. So
That's great.
We're in a different situation, but
how about any mealtime behaviors that you guys are struggling with? Some of the therapists that I talk to, they're talking about, overstuffing, putting too much food into their mouths. And that can, again, be that, they're not, it takes a lot of work to find the foods depending upon your vision, right? And so, you want to put everything in your mouth because it's so much work to find it. But food stuffing was a big one, and gagging was another one, and spitting it out, or taking the food out of their mouth and putting it down. Tell me a little bit about some mealtime behaviors that are with your kids, or that you've even seen with some other kiddos, maybe in their class, or when you go on play dates with other kids who have low vision. Tell me a little bit, Sarah. What are some of yours?
We've dealt with all of those except the spitting. So usually if we put food in her mouth, she immediately takes it out and wants to break it in half, or I don't know. Mm-hmm. She loves to, even if you just hand her something, she'll break it before she puts it in. Gosh, I'm sorry. She'll break it before she puts it in her mouth. And then, what were the other ones? Oh, she's like total Cookie Monster. Mm-hmm. And she doesn't chew very well. She munches, but she doesn't have the rotary chewing. So sometimes it can lead to gagging as well. But, mm-hmm. And not to get totally gross, but it's the food comes out whole, it's a half a grape, in her diaper. So yes, it's she doesn't chew it, and your body doesn't really digest certain things very well. And so I'm like, oh, that's what you had at school today.
Right, and that's so common. When I was in grad school 20 years ago, we had to do 3 meals a day blindfolded. And it was really challenging. And I have to say, I didn't chew as much because I didn't really enjoy each bite because I was so panicked about finding the next bite that I didn't chew as much. And I didn't really enjoy my meal as much because I was, again, so focused. I was so afraid that someone was going to move the plate on me and I wasn't going to be able to find what I wanted or what I was looking for, or that something was going to happen, as irrational as it is, there's going to be an earthquake and my plate's going to fall off and I'm not going to be able to eat. Irrational thoughts of people stealing my food or watching me eat, and it just made me overstuff and not chew as much. And as embarrassing as this was, I even drooled a little bit during it because it was I was focused so much from all my other senses to find the food that I kind of forgot about swallowing my saliva, chewing more appropriately. So it's interesting. Again, it was, we had to do that for all of our senses. We had to, eat meals without being able to hear, putting earbuds in and then Mickey ears on top of that. And just to be able to, help us realize some of the struggles that our clients go through. But that was really telling for me. And I always remember that experience when I'm working with a child with low vision, that these are, and what Betty's doing is breaking those food particles apart. She's getting all the sensory information from that food and trying to break it up into pieces that she feels comfortable chewing, that's not going to have her gag or have reflux or make her choke. And it's really a safety feature to be able to manipulate that and put it in. Whereas I've been in IEPs again with behaviorists, and they're just okay, Johnny will not break foods apart before he eats them. And I'm like, yeah, how does a child know how big that food is? I mean, we need to be able to, safety is number one, right? Safety in eating is number one. Number two is, good nutrition, and it just moves on from there. Betty's trying to make sure that safety is her number one goal, and then to be able to feel full after that. And, it's a really good way to protect her airway. And, most of our kids that, struggle with textures are struggling with breathing. And our bodies are always going to pick breathing over eating. And, if our kids have a stuffed up nose or, respiratory infection or anything like that, they're going to pick breathing over eating every single time, which we want them to do, right? And so, using those skills to be able to make sure that, that nothing's going to go into her airway is fantastic. I commend her for doing that. Hopefully, school teacher, not feel so uncomfortable doing that. Any mealtime behaviors with you, Lauren?
He used to, still does, but he's 2 and he's a boy, so he's disgusting. But he likes to either put his food like in his liquid, like his milk. He always has milk, or dump. When he was younger, he used to always dump his milk into like his plate. He liked the liquid. See what happens, Or if he dumped his food into his milk, he would then drink it to see what it tasted like. So that was kind of our really brilliant table manners. But he still does it. He still tries to pour his milk into, or vice versa.
Yeah, that's a good one. Actually, I haven't heard of that one in a long time. I worked with a kiddo. This is when I had a private practice in Arizona, and he kept doing that too. That's so funny. He had, I forgot what the diagnosis was, but the tips of his fingers didn't really give him a lot of sensory feedback. I'm forgetting what that diagnosis is. So he'd either roll it up in his palms to try to feel what the food was, so he'd make like these little food balls, or he'd throw the food, into liquids. Because of the viscosity of the liquid, he could actually manipulate the liquid and feel the food coming down because he couldn't get it with his fingers. I'm not sure if that's what it was doing, but I remember that being, that was just another way for him to feel the weight in the cup and feel that piece of sandwich, which would, gross everyone else out. But he was able to really, take a couple sips of his liquid and then have that big piece of sandwich come down and chew it. Another thing is a chewing issue is, sometimes a little bit of liquid will make that be easier to munch. So I don't know if he's doing that either, but I haven't thought about that particular behavior in a long time.
Yeah.
So
come to our house. You'll see.
Yes, I'll be writing that down. Yeah, forget about that one. That's great. How about you, Sarah?
I was just going to say to Lauren, that's great that he's even using an open cup. I think that's amazing. We're not there yet.
Fantastic.
For us,
2.5. So.
Well, that's still great.
Nice.
We're a lot of gagging. So as long as she can, when I am feeding her, she will gag because she hasn't touched it first. She doesn't know what that texture is.
Right.
And then she'll gag when it's in her mouth because it's the first time she's experienced it. So as long as I can have her, we're both feeding her at the same time. That's what our current MO is. She eats with one bowl and a spoon or a fork, and then I help her as well. Just because we'd be sitting there forever if she were to eat. She likes everything, but she's a slow eater. Yeah, she likes to do it. If she can do it independently, she's fine.
Whoops.
Sorry about that. So that's for us. It's gagging because she doesn't have that sensory information until it's in her mouth. So if she can do it by herself, we're good. No other behaviors yet, but we haven't moved on to cups. We're still working on using utensils and, trying different things, and giving her options usually is helpful too. So, having it cold or warm so that she's being more involved in the process. So,
yes. One of the ways that I decrease, and I don't have a spoon with me, so I'm just going to use my dry erase marker. One of the ways I decrease gagging is being able to present. So if this is you feeding, is being able to present with the spoon being lower than the upper lip. So being down here, does that make sense? So that she has to kind of reach out and eat that and take the bite of the spoon. If we place the spoon into the mouth, or we place the spoon too high, too low, what happens is that it ends up having this little neck flexion like this, and that triggers a gag reflex. So we always want our child to come forward if we're spoon feeding. I don't know if this is a technique that you've done or not, is we want her to come forward and take it off the spoon. So having it here and letting her come forward to take that off. two reasons why that is really important. One, it builds trust, because if by any chance we push the spoon back in too far, or we've done that in the past, and so they end up having this hyper gag reflex because of an accident of us putting it too far back or putting too much pressure onto the tongue, making her come forward. It's called the Get Permission approach by Marcia and Klein. And it's placing the food and giving her permission to eat it. So if she chooses not to take that bite, it's fine. If she chooses to take that bite, it's fine. But she's making that decision. And it's one more step of being able to get a little bit faster speed when we're feeding a child, to be able to say, oh, mom's not going to shove it into my mouth. I don't have to worry about that. I'm actually having some control of getting that next bite. So it increases the speed of the meal as well as decreasing the gag reflex, because every time you lean forward a little bit, it closes your airway and opens up the way to the esophagus and allows for the gag reflex to be a little bit not as hyper vigilant. So just throwing that out there, if that might be a tool that may be helpful for you. Yeah.
We actually, I just am remembering a year and a half ago, we also did, because now I'm remembering, Owen actually used to gag when he first started with solids. And we got recommended either doing those P&Q teethers. They're like orange chew. So given that, but then it didn't really help. So then we started giving him the vibrator teethers.
The Z-Vibe
before the mealtime. Yeah, it has it was a monkey by the Target, but the monkey with the banana, and he would bite down and it would vibrate when he bites. And as I was getting his meal ready, he would have his teether, and that kind of helped. Having the vibrator teether helped him stop gagging. I'm remembering this now. Yeah.
Yes. Oh, that's great. See, I love this. And what that does is vibration actually gets the sensory system ready for any type of movement. So if you think about, for our perspective, if someone was to use one of those vibrating massagers on your back before they actually start touching you with their hand, think of it kind of like it's preparing the sensory system for the expectation of food. That's a great tip. Yeah, Sarah, if you want to try that, you can get them you can get them at Target or even using an electric toothbrush, something a little bit cheaper of an option works. Also, you can get them at talktools.com. There's these little vibrators called Z-Vibes, and they're tiny like a little toothbrush, and you can get back in there and stimulate the tongue to be able to get that sensory feedback too. That's perfect. Any other comments with that?
Betty hates vibration.
Oh, really?
Yeah. She will not let us brush her teeth. It takes two adults and her screaming and trying to scratch us to get in her mouth to brush her teeth. So she clenches her jaw and she holds her lips tight, and we were oh, let's try vibrating toothbrush, and it was 10 times worse. Oh, no. So I don't know. She doesn't like it, but I guess we're all different, right?
Yeah. Well, and that's an interesting thing. We all have our different sensory challenges. I used to teach teeth brushing classes because of the fact that 40% of our pediatric population have tooth decay. It's the number one childhood disorder is having tooth decay. And of those 40%, they usually are picky eaters as well. And so we really need to get into those mouths and be able to stimulate getting that bacteria off, because there's a lot of studies too that say the more bacteria that's in the mouth, the less likelihood they're able to eat something else like vegetables. So making sure that we have good oral hygiene with our kids is really important. So some of the things that we did in our toothbrushing class was wrap the child up like a little burrito with a warm towel, so it kind of feels a little toasty, and so then it's not it's not batting like this the whole time. So wrap her up like a little burrito, and then also doing what's called the 1-2-3 approach. And so that's going in just for 3 repetitions. So going 1, 2, 3, out. 1, 2, 3, out. You probably do all this, Sarah. And then increasing that 1, 2, 3, but always using 3, but just using that timer so that they know when it's going to, this horrible feeling is going to stop. And we even do that with any oral motor exercises that we're doing. If I'm going into the mouse, doing any stretches, we always do a 1, 2, 3 approach, because if they don't know when this horrible thing is going to end, right? I mean, yeah. I hate getting blood work. I hate it. And so I'm always like, give me a timeline. Start talking to me, because I'm like looking like over here in the corner.
Me too.
And the nurse is, I'm so bad at needles. So the nurse is like, okay, 30 more seconds. And in my head, I'm like, I can handle 30 more seconds. 10 more seconds. Okay, almost done. All right, I'm about to take it out. And, if not, I'm fainting. No joke. And I'm 6 feet tall, so it's a long drop. So, it's being able to give them a time to let them know, how much longer this is going to happen. Just throwing that out there too, just in case that's something. I want to move on to this approach that I was taught at the Anchor Center by the speech pathologist. And since then, when I pulled the 52 other therapists, none of them knew this approach. And so I'm so grateful to the Anchor Center and their training that they've given me. But instead of doing a hand over hand approach, so hand over hand, you guys probably, you're nodding your heads, you already know this. I didn't know this. Hand under hand approach. So my whole career, hand over hand has been the thing. So for those of you who don't know what that is, if this is a cup and I take the child's hand, I'm doing this hand over hand approach to grab the cup or to, touch the food. And she taught me to do the hand under the hand to be able to have this more gentle approach instead of being so forceful. Yeah, I was shocked and I get so excited when I learn something new, and I was just like, hey, therapist, did you know about the hand underhand? And they're like, what are you talking about? And I was like, oh, let me show you. And so do you guys use that? Tell me about that. I really was just like absolutely fascinated by this. So let's talk about that approach and if you guys use it. Sarah, go ahead.
Yeah, we use a combination of over and under, depending on what per mood and what we're trying to work on.
It works for all kids. I mean, I've been using it across the board with, some of my sensory kids, as well as just, our neurotypical kids with some feeding challenges. It's probably the best technique I've learned in the last year. And this was just a couple of weeks ago, Lauren, when I saw you. It was just, my mind was blown about how much more of a gentle approach it is, because we're already trying to get them to eat, asking for that extra bite. It's already this anxious driven kind of mealtime. And then this approach is just so gentle. I love it. Lauren, how do you use it?
We're Anchor Center followers, so I've been using it since he's been 9 weeks.
Wow.
Either that or feet. But yeah, it's just, he doesn't really mind too much about things though, so I sometimes forget. But I'm more next to him. He likes me to kind of do everything first, then he follows me. But yeah, he just, with new things, I just kind of take his hand and lead him away. And if he doesn't want it, I don't push it. If he wants it, then we keep going, and then he's all about it. So yeah.
Wow.
But
Tell me
Anchor
when
Center taught me pretty much everything I know about.
Yes, they're great, and we're saying a plug for the Anchor Center here in Colorado. So tell me, when and how did you learn those techniques at the Anchor Center? Like, did you take a parenting class to learn those techniques? Was it just being there and one-on-one therapy? Like, tell us a little bit about that.
The Anchor Center is amazing. I mean, we've been going there since Owen's been 9 weeks old. So they have the infant program, onto the toddler program, and then preschool. And with infant and toddler, you're in the room with them. And a large part of, especially their infant program, is educating parents as the kid is in the program. So if we're in music therapy, we go through about 3 centers, and we're in music therapy, go hand under hand to touch the instruments, or hand under hand to do this. And they kind of teach you throughout that. Or also I learned a lot about feet. If a child is hesitant, because hands have so much information, and the feet give kids a little bit more confidence, and it's not as invasive to them. So, if I'm just using music for example, but the drums, a lot of kids don't want to go on the drum because it's way too much for them. So, sometimes we'll just let them have their feet on it. You take off their shoes and let them just feel the vibration with their feet. So, and I know they have snack time, not for the infants, but for the toddler program. And some kids who can't eat for, G-tubes or whatever reason, or gagging or just too much. It's more of sensory play and just letting the kids, and some kids, just kind of have a tray and they feel it with their feet. And it's a lot of the parent education is throughout each activity and just as it's going. And then they also do parent pullouts once a month to educate the parents on specific topics. And they have volunteers who take the kids for an hour and a half, and that's the hour and a half. And, great. And we get educated on different topics. So it might be motor, it might be the school system, it might be, the extended learning curriculum. One time it was a music one. So once a month once every month, every 6 weeks, we get a parent pull out and really get an intense education on how to do it. So, everybody should check it out. It's a great place.
Yes, it is.
I have a special education background, but I know nothing about the visually impaired. And then I had Owen, and they kind of taught me kind of how to access the world and not be so intimidated by it, and just little things, Mardi Gras beads and Mylar paper are the best toy for any infant. Who would have known?
Can we say what our kids' diagnoses are?
Oh yes,
I don't think we've gone through that.
Yes, no, we haven't.
So, Betty is 3 and she has CVI, cortical visual impairment, and a bunch of other stuff too, but that's her visual impairment.
Thank you. That's a great idea. Lauren, you want to tell us about Owen?
Owen has microphthalmia in the left eye, so it's an undeveloped eye, pretty much born with no eye. So he has a prosthetic in the left eye, and in his right eye he has optic nerve dysplasia and optic nerve colobomas, and then just kind of the eye wasn't formed correctly, so his retina is dragged and some other things. So he has some vision in the right eye.
Oh, buddy. And Sarah, how about your daughter?
Yeah, she was born with optic nerve hypoplasia, so that's bilateral for her. And as far as we know right now, she doesn't have any functional vision. She does seem to have a little bit of light perception.
Okay.
So.
Okay. And then we didn't get to hear from you about the hand under.
Oh, yeah. That's been amazing for us. Yeah. Our child development specialist that's been meeting with us with early intervention, she recommended it to us, and then as hand over hand, right? Hand over hand.
See?
And
then, so just like me, you didn't know.
Right,
okay.
Right. And then our vision specialist came and said, okay, this is all great, but we need to switch it to hand under hand because you're showing you. And so you're showing her. So we just word, let me show you. And then she puts her hand on our hand when she is ready. And it's been really neat. It's been amazing, all the stuff we've been learning.
So loving, too. Like, just the way you said it. It's just like, and then she grabs my hand. Like, usually our kids are kind of like this, And so I just love that. I am fascinated. I need to write a blog about that specifically because that is it's such a loving gesture. And then the Sarah's.
Fantastic for any child, not just one with vision impairment.
Yes.
So.
Yes, heck, get your husband to do stuff hand under hand. So the Sarahs, tell us a little bit about your guys' education. So, Lauren got all this great education from the center that her son actually goes to. What about you guys? What happens in Utah and where do you guys go? And what?
So we don't really have like a regional center. I mean, I don't know if that's what you're what's it called again? Sorry,
the Anchor Center.
The Anchor Center. I don't know if that's what that's considered.
Sorry, my sound went out. Sorry.
Okay. I know in California they talk about the regional center. We don't have anything like that. So we have our early intervention program, which the state runs, and then there's like local programs. So we have that, and then there's also through the Utah Schools for the Deaf and Blind, it's called the Parent Infant Program, which is 0 to 3, and they provide the vision specialists that also come to your home as part of early intervention. And then they have conferences and things like that for families and parents to get additional training and education about how to help our kids. But
so great.
Yeah. And actually, Sarah and I have the same, we're not in early intervention anymore, but we have the same vision specialist.
Yeah, she's been amazing. Yeah. So for us, those conferences that we've been going to, they do about 4 or 5 a year, 2 really big ones. And then they'll have different groups that we meet up with that are sponsored by the Parent Infant Program through early intervention or through the Deaf and Blind School. And then we'll just do like different activities as a family, and they'll cover costs for the whole family. And so you can network and meet with other people. So it's been neat.
Wow.
And they also do with the Parent Infant Program, they do weekly toddler playgroups, almost weekly. So you can meet, and if you can make it to it, it's about an hour, a little less than an hour. So
fantastic. Wow. I'm like so happy with your guys' community. It's so strong. You know, when I'm talking with other parents with different diagnoses, there's not really a lot out there. So it's so exciting to kind of, hear about that. Some of the other things I want to talk about is your language use and your vocal tone when you're working with your children. Did someone teach you that? Was this a natural thing? You know, what language do you use? I mean, as a speech pathologist, I'm always fascinated by tone of voice and how dads use a different tone of voice than moms, and what language we use with the kids. I remember when I taught a class, again, back in Arizona, for kids who had vision impairments and or had hearing impairments, how, it was very different, their, parents' tone of voice and the language that they used, or maybe they didn't even talk at all during the meal, because they're like, oh, you can't really hear me, or, oh, why am I going to talk about what's on our plate? You can't see it. And so I was like, oh, dear Lord. Okay, let's talk about this. So tell me a little bit about, your language use and your tone, and we'll start with you, Sarah. What do you say during the meal time?
Eat your beans. No. I find that so Betty's 3, but we still kind of tend to talk more gently, I guess, or I don't know, because she still seems like kind of a baby. I mean, developmentally, she's about 9 to 10 months old. So yeah, it's actually been really great for our family because I think, a typical 3-year-old can be super aggravating and easy to bring out the frustration in a parent. And we don't really have that with her so much. She definitely has her behaviors that are challenging, but we, early on, we didn't know what all of her challenges would be. There was a time we thought she might have hearing loss. And then there's the vision factor, of course. So from the beginning, we tried to incorporate all of, we're telling her all day long about what's going on and what's in front of her. And so there's a lot of language, a lot of exposure to, audio stimulus. And then also just, to bring out and stimulate her vision, a lot of exposure to different visual stimuli as well.
Fantastic. And when you say that, when you're talking about visual stimulation, are you saying that with the food or the contrast with a placemat on the plate? Or
she responds best to high contrast. With CVI, it's as simple as we can make it. So in terms of books and things like that, we go for single image on a single color background is the best, and those are kind of hard to find. But we've made some of our own books and things like that, and so we kind of try to translate that to the rest of her world too. So with her food, the Easy Peasy tray has been great because it's just one color, and then we can easily put the foods that contrast on it, so she can easily see them.
Fantastic. And Lauren, how about you? Your language use, your tone of voice?
We talk a lot in our house. I have 2 like chatterboxes. Like they don't ever stop questioning, asking. And then I always have to repeat Owen a lot. Like if he says something, he needs me to repeat everything he said. So there's a lot of talk in our house. Always has been. But and I'm also, I mean, like I said, I used to be a special ed teacher.
Right.
So I feel like I do a bit of teacher talk, you know? But it's a lot of patience. Just kind of talking to Owen about his world and kind of, oh, yes, that's a truck. That's a yellow truck. Yes, that's a yellow digger truck. We use a lot of language, a lot more than probably I feel like a typical 2.5-year-old would have or need. But yeah, we always, yes, that's a big bowl. That's a little bowl. It's hot. It's cold. We try to use a lot of adjectives and description. And just kind of a lot of, this is what's happening, oh, we're going to get in the car and we're going to buckle you up, or
Gotcha.
Sometimes it happens, sometimes it doesn't. There's a lot more description throughout our day, for sure. So, and he needs to know it can't just be a digger. It's what kind of digger is it? It's a skid steer, it's a bulldozer, it's a payloader. So he needs a lot of that extra bit, or he saw, we were at a restaurant or smoothie place the other day and the woman had a glove on and he wanted to know why she had a glove, so I had to go, whereas I feel like a typical kid would see the box of gloves, see her put on the gloves and know, oh, she's going to prepare my food. Whereas all of a sudden this woman was wearing a glove. So we had to go into a whole, description of, oh, do you see the box over there behind the counter? She put it on so our food stays clean and safe and so our hands don't get dirty. So there's a lot of storytelling in our day, and a lot of description. So, and he's a redhead and he's a pistol. So there's a lot of talk, and a lot of what's happening and kind of telling him what's going to happen, so he's not surprised by things.
And then let's just take that a step further. I think we lost Sarah too. But let's take that a step further. Another strategy that some of the therapists said that they utilize a lot is either a verbal schedule or a visual schedule as well. So verbally saying, what they're going to do during the mealtime, like I'm going to put this on your plate and then this, and then, or we're going to wash your hands and then we're going to eat and then we're going to do X, Y, Z. Do you guys, utilize that and tell me a little bit about how you might do that in the mealtime too? Oh,
we do.
Sarah,
we do that, and we also use pictures because she does have vision. Actually, I should grab them so you guys can see. Vision
do.
kind of comes and goes. I'll go grab some, and Lauren, you can share your bit.
Okay. Sarah, welcome back.
Thanks.
We do a lot of song. We do a lot of like saying, and our days. I don't like a visual thing of what's going to happen because if it changes, it really throws Owen off. Owen's really routine based and regimented. We can't. If he had one cup, I can't use another cup later. If I always fed him because I was a stay-at-home and, we nursed for a while, and then he would never let even his dad give him the milk. He's very, it took a while to let him have other people, even his father, do things. It was no, mom has to get the milk from the fridge. So, there was a lot of that. So I don't like kind of a visual thing for him, only for him, because if it gets thrown off, it gets thrown off. If he knows it's coming and it doesn't, we have problems. So, but we do, and Anchor does it a lot, especially with mealtime, a lot of songs. So, like at Anchor, when we start snack time, they all get a washcloth and we sing, "This is the way we wash our hands." And it's the song, so all the kids know, okay, we're going to wash our hands with a washcloth. And then, Miss Zoe is going to give us the placemat with the plates and everything. So we brought that to home before we eat. Not anymore, but we do. This is the way we wash our hands. And then, we would eat and then clean up we have a song for cleaning up. So we do a lot of songs and the same songs.
I love it.
So Daniel Tiger has some really good songs. But the other thing I did want to say though with eating that I taught that I thought was a really good it kind of saved our world is because Owen hates getting clean. He doesn't like washing his hands. He doesn't like even the washcloth, and I can never clean his face. So at the Anchor Center, they taught us there's so many nerves around your mouth that if you move it all like, as you're cleaning the face and you move it all towards the lip, everything like if you clean here, you clean down and then up. And so we did a lot of that with the song, this is the way we clean our face. And
fantastic.
And then he would actually let me clean his face after mealtime. So we used a lot of music in our house to get us to the next whatever we're doing in terms of scheduling and time. So
I love it. One of the things that I use, which they're actually located here in Colorado. Have you guys heard of Neat Cheeks? It's a flavored wipe. If you look up their website, I think it's Neat Cheeks, like cheeks.com. They're flavored wipes. And so they're like a baby, if you're going to use a baby wipe or a wet washcloth, but it's flavored with stevia. Not my favorite thing, but I do love the reaction that I get. It lets kids really want to have their face wiped because it's nice and tasty. It's almost like a treat afterwards, and it's a nice way to be able to wipe their hands. And they come in itty bitty packages as well as like packages like a baby wipe. And I have a lot of kids who have been very aversive to having their face wiped. You're like, Miss Dawn, is it time to get my Neat Cheeks now? And I'm like, okay. and being able to wipe their mouth. So you might want to check that out because they're really a mom-based company. They were on Shark Tank too. So Sarah, you kind of missed it a little bit, but we were talking about, whether you use like a visual schedule or you do a verbal schedule during mealtime, telling them, maybe your daughter, like what's going to be happening or, we're going to go to grandma's and eat lunch, or how do you let her know what the mealtime is going to what the schedule of the mealtime is going to be like?
I'll just say it in passing, when we're getting ready to do it and give her a quick rundown of what to expect. She's not too particular when it comes to a routine.
Awesome.
Which is maybe good, maybe bad, but she's pretty easygoing. So as long as she's got her food when she's hungry, if she doesn't want to eat at, said time, I just don't worry about it and we come back to it. But one thing that's helped us is that eating at the counter or at the table, we have a hook on high chair. And it just goes at the counter. And so she knows it's, and then she has full range. She can do whatever she wants to do there. And then when she's ready, she can let us know when she's done. So we just kind of help. I kind of follow her lead, I guess, on the routine after we get in the seat. So when she says she's done. I let her choose how much she wants to eat. Even though I always want to shovel in more, but that's not advised. And it's not going to have a good result anyway. She's lower weight as well. So we're always trying to get more in her, but so we just try to do meal times more often. Good. So we have more opportunities instead of, extending, because when she says she's done and she's ready for other things. So we have,
well said.
Bathroom time that happens next. So,
for all the parents who are watching that, I couldn't have said that any better because we do get a lot of parents who really want to force feed those extra, 3 or 4 bites to, get weight up and, it just breaks trust. So, wow. Amazing. And then Sarah, did you grab the stuff so we could see?
So Betty responds really well to, if pictures have like a high contrast and it's like a single image. So we put the words on it too. It's backwards, I know, but snap piece because I have a 5-year-old too, so she's learning to read, and we got the word and the picture, and it's simple, so she can recognize that it's food. And we have a ton of foods, so we'll give her initially. We would be, because for breakfast she almost always eats the same thing, which is like banana and Cheerios and water. She doesn't like milk, so we initially would be like, Betty, do you want to eat a banana or your box? And so, because it's like too hard, because, if she wants an orange. I'm like, I don't have one to give her. So I'd say, do you want a banana or blocks? And then she would choose one. Even if she chose blocks, I'd say, sorry, it's time to eat. You're going to eat your banana now. And then, or we'd say, Betty, do you want your banana or your Cheerios first? And so then she can choose. You know, making choices is a really important part of like her learning. She has a little bit of control over her world. So I just took pictures of like her toys and her swing and her stroller and like, you know, her crib and whatever. Do you want to do music or do you want to go in your swing? And so just having this simple background with CBI that works really well. So
I love it. Love those. So any other comments, questions, anything from you guys, you know, in these last moments that we are on the blab? Anything else that if we have a parent on here that's, you know, not able to write questions or maybe comments that you guys have just learned today or anything else that you might want to add? No. Yes, do Sarah.
For us, I think when I hopped off earlier, you guys were talking about language.
Yes,
and how important language is. And so I don't know exactly. I'll catch up later, but on what you guys discussed. But for us, so we started with early intervention, and Maeve was diagnosed when she was 5 months. And they were saying, okay, so start, you know, teaching her how to get her clothes on. And I'm like, she's so little. I was like, that's silly. But now she can put her clothes on by herself. And just doing those daily routine dialogue and narrating is huge. And it's been amazing for us. And now she's not even 2, but her dialogue is awesome. And her comprehension is amazing. So that just, even if your child isn't liking to eat, now with her comprehension being as good as it is, I can talk her through, you know, these different things. Like when she starts to gag, I'm like, oh, what do you need? Hold on, you know, and she'll say water, and she'll tell me what she needs. And I think it's really good just to focus on what you can do. You know, some things you can't control, but you can help them, talk them through it, even if they don't have words yet. And then you'll get there.
Yes. Lastly, I had a couple of people who are actually watching who said that they don't have a child who has a vision impairment, but they do see interactions with parents who have children with vision impairments, and they're not really sure how to act, respond, and they might want to initiate a conversation, or they're saying whether or not they don't know whether they should offer help or not offer help, or in our last moment, can you guys give us a little tip for those who are in the community, who are watching you guys do all this amazing work with your kids, and what they should or shouldn't do? I would love to hear some advice from you guys. Sarah, you want to start?
No. I don't know. I feel like, well, we're just like a normal mom and kid, kind of, so just treat us like you would treat anybody else. But I know, I feel like the internet kind of makes it seem like we're this group of people that are so easily offended or something, and don't say these 10 things to us or you'll be on our bad side. But I feel like as long as people are well-intended, I'm happy to talk to anybody, answer their questions, accept their help. So yeah, I try to, if people are being nice, I'm never going to see that as a bad thing. So
I love hearing that. I love hearing that. How are you, Lauren?
I second that.
Yeah.
Yeah, I don't know. I mean, we're like any other family. We have our ups and downs, and, we have, my kid happens to be visually impaired. Yours might, be defiant. I don't know. It's different, but it's always nice to hear a compliment. I'm not going to lie, because it is really hard, and it is nice to hear, wow, look at your kid. He's amazing. It does, for me, it does help because I'm with him all the time and I don't always feel it and see it, because you're with him for 24 hours. So, I mean, and I don't mind educating, because I mean, I never knew about it, and I now find it fascinating. So, as long as it's good intention, I come on up. Yes. And I will take your help. I will take any help. yeah, so
Love it.
we need it.
Sarah?
We need a little pat on the back every once in a while, I think. But
absolutely.
I think every parent, grandparent, aunt, uncle, person, anybody needs a little pat on the back every once in a while. So
I think that's so good, because it's I just being a therapist, I'm always like, okay, if I see someone in the supermarket, and I remember a couple of years ago, I got viciously attacked by a mom. I was in the supermarket, and it was, being a therapist, you can kind of diagnose in the supermarket very easily. And I'm like, oh, okay, this kiddo obviously has autism. He's having a meltdown. And I went up to them and I just said, hey, Mom, I'm a speech pathologist. I'm here in the grocery store for the next 20 minutes. If you need anything, let me know. And she was like, how dare you think that I might need help? And it just went off on me. And I remember going back to, some other moms. I'm like, okay, what was my language, wrong? How did I, maybe I shouldn't have said I was a therapist. Maybe I just should have said, that, I'm here to help if you need it. I was so taken aback by that. I was, I was like, I want to make sure that, everyone is, accepting my help as easy. But it's neat to have comments of people that are here that said, how can I do that? And what can I say, or what should I not say? So Sarah, how about you elaborate on that too?
Oh, for us, I agree with everything you guys have said. It's been really neat, because we really have to rely more on our village. Yes. Honestly, with an average kid, you just let them do their thing and you don't get in their way or don't need to intervene too much. But with a kid who has a vision impairment, you really need to get in there and show them some things that they're not going to be able to experience otherwise. And same with the people that are around us. We can all learn from so much. And I think it goes both ways. I've learned so much from my daughter. So it's been neat.
Wonderful. And you guys, thank you so much for coming on and just sharing all of your tips, because I learned so much today. Thank you so much. And, I'm sure all of our viewers are going to feel the same way. And there's a lot of therapists who couldn't join, but who will be watching the replay because they don't get out till 5. So I think your guys' tips have just been so helpful with helping other therapists, because we kind of get thrown in there and it's like, hey, guess what? You have a child with a vision impairment on your caseload. And you're like, I've never done that before. So, any students and other professionals who are watching this are going to glean so much information. So thank you so much for doing that and taking the time. And we will post, on our website and also with our social media, the playback, and it'll also be on Easy Peasy's YouTube page as well. So if you're looking and you want to watch it, or you want to share it with another, mom or a professional that needs to watch this, please feel free to do so. And, Sarah from Bringing Up Betty knows how to do all that techie stuff too. So the two of us can get it out there so you guys can watch. So thank you so much. Appreciate it.
Thank you.
Thanks.
Bye-bye. Thank you. Bye.
Thanks.